Good morning. One of our most important tools in fighting COVID-19 is testing. It helps public health experts know how widespread the virus is, and it allows those who have been exposed to the virus or with symptoms to determine their status and take the necessary precautions. We've long offered drive-through testing at our 3 Department of Public Health clinics, but there's also a demand for test kits that residents can pick up and use when they need to. So today I'm happy to announce a temporary expansion of our program to hand out test kits to residents. Starting this morning and continuing through Friday, from 8 a.m. to 4 p.m., we'll be handing out free PCR saliva test kits at the North County Recreation Complex at 2577 Redmond Avenue. No appointment is necessary. Just drive up and we'll bring a test kit to you and every member of your household to your car. We're all prepared to deliver as many test kits to the complex as necessary to meet the demand. If the demand continues next week, we'll hand out more test kits. Residents must return the kits with their samples to one of our 3 Department of Public Health health centers, John C. Murphy in Berkeley, the North County Health Center in Pine Lawn, or the South County Health Center in Sunset Hills. Also starting today, the St. Louis County Library is adding a 3rd location for area residents to pick up COVID-19 test kits, all provided by our Department of Public Health. The Lewis and Clark branch at 9909 Lewis and Clark Boulevard will offer a limited number of free COVID test kits for at least the next week. Kits at all library locations can only be reserved by calling 314-994-3300. Please note that in-person reservations will not be accepted. And again, the kits and their samples must be taken to a Department of Health Center location for processing to get a test result. The other participating library branches are the Rock Road branch at 10267 St. Charles Rock Road and the Weber Road branch at 4444 Weber Road. Later this week, we anticipate adding more branches to that list, at least temporarily, to respond to the current demand for testing. While the Department of Public Health has been providing 25 kits per branch per day, we anticipate increasing that number substantially. We'll have more details on the library expansion of this testing program on Wednesday. Finally, our partners at the Eureka Fire Protection District are again stepping up to help in this pandemic. From 8 a.m. to 4 p.m. this Wednesday, the district will distribute as many as 5,000 Department of Public Health test kits at the Eureka Community Center at 333 Bald Hill Road. No appointments are necessary. We want to express our gratitude to our partners at the County Library, the Parks Department, and the Eureka Fire Protection District for allowing us to get as many test kits to as many residents who want them. It's vital that if you experience symptoms of COVID or if you're exposed to someone who's positive, that you get tested as soon as possible. A couple of final reminders. Wherever you pick up your test kit, you must bring the test kit with the saliva sample to a Department of Health clinic for processing. Results are generally available within 24 to 72 hours. Free drive-through COVID testing is always available by appointment at our 3 Department of Public Health clinics. For appointments and more information, visit revivestl.com. The number of COVID cases reported each day is falling. That's good news. However, the virus is still spreading throughout the community. We cannot let up on our mitigation efforts that include vaccines, masking, and testing. If we let up now, the virus will prevail. The effective mitigation efforts will get us to where we want to be, to a place where COVID-19 is not a driver in our daily decision-making. Before I go, I want to thank our road crews here in St. Louis County and across the region for your hard work this past week. There was a lot of snow to clear, and cold temperatures and wind added to the challenge. You are greatly appreciated. And with that, I'd be glad to answer any questions.
Dr. Page, what makes these additional opportunities so important? You kind of alluded to it at the beginning of your comments. why is it critical to have more of these tests available and continuing to fight the virus? What's big about this?
So the question is about the importance of having tests available in the community. In order to slow the spread of the virus in the community, we have to know who is positive so they can take the appropriate precautions to not expose other people. And the same token, there are other illnesses that are common in the winter. And if someone's sick, they'd like to know whether or not COVID is something that they need to be concerned about. We know that making testing available in the community is a priority for our residents. And earlier in this year, it was very difficult to find. And the virus was spreading more quickly than tests were available. As the virus cases are starting to come down, and as the tests are starting to become more available, we want to make them available to our residents.
Is it fair to say that we're past the worst of the Omicron surge at this point? Is this kind of the back end of it, and the testing helps to move us forward more, or?
Yeah, so the question is, are we past the worst of this surge? Looking at the trends and the case numbers, we're clearly coming down. And even though we're past the worst of where we've been with Omicron, we still have a lot of cases in the community, cases that are comparable to some of the worst peaks that we had a year ago. The difference is now that we have vaccines readily available. We didn't a year ago, and testing is more widely available in the community. So I think we're getting to a point where we can manage this pandemic much better with the balance of vaccines that are available, testing in the community, and the cases heading in the right direction. But we're not out of the woods yet. We still have a lot of disease in our community. We still need to keep our precautions in mind. We still need to be thoughtful as we get through these remaining winter months, and we'll be in a much better spot in a few weeks.
If I could switch gears just a little bit, tomorrow there's a scheduled hearing in the latest mask mandate battle between the county and the Attorney General. Could you update us on where that stands from the county's perspective and where we are heading into that hearing?
So the question is about hearing regarding local government's ability to issue public health orders and the Attorney General's role in that case. And public health departments and local jurisdictions from across the community are fighting to get a rational interpretation of state law. As far as our strategy in the litigation, we'll know more about that tomorrow, and we'll know more about the arguments and how the court's going to react. We do believe that St. Louis County's position, combined with other rural and urban counties in the state, is a strong one, and we believe that we'll be able to establish that public health authority by local government is important, and it should be the law in our state.
So at this point, the mask mandate in the county still is in effect?
Oh, the mask mandate in the county is absolutely in effect. Absolutely.
Are you confident that you'll be able to withhold that or hold that in place in the hearing, given the Attorney General's move to try and quash it again?
I'm confident in our position, and I'm confident that the authority that we're using to issue a mask mandate in St. Louis County is solid. It's based on more recent state law, and absolutely our mask mandate is in effect, and it'll stay in effect until our public health department determines that cases are at a level of moderate transmission. I mean, that's our goal. That's what we're looking for. Cases are headed in the right direction. I'm optimistic that we'll get there, but I can't tell you right now when that'll be. But we're looking at these numbers every day.
Thank you.
Any other questions? Okay, thanks.